Okay, we're going to get started now. Thank you for everyone coming today to join us for the Chamber Connect event, which is about COVID-19 exposure and returning to work. I would like to introduce you to our sponsor first, Jenny from BBSI. Hi, Jenny, would you please talk a little bit about your organization?
Yes, hi, good morning, everybody. I am Jenny with BBSI, and we are a local team of subject matter experts providing services in workers' compensation, HR, payroll, talent acquisition. What makes us different is that we're very engaged. You're not going to call into a 1-800 number and be placed on hold or receive some sort of PDF. We collaborate with the business owner to understand their story, where they want to go, and create a plan of action to make sure that we're jumping those hurdles before they get there. So we'd love an opportunity to meet all of you and see how I might be of service. Thanks so much.
Thank you, Jenny, for joining us today and talking about BBSI. We appreciate your sponsorship with us. So today, our topic is COVID-19 exposure and returning to work. And we have Dr. Frank Polanco with us to talk about that. I did want to say that after his presentation, we will be doing 10 minutes of Q&A. So if you have any questions, please post them in the chat and he will go through and answer those questions for you. So without further ado, I'd like to introduce Dr. Frank Polanco. And Dr. Polanco is a workman's comp certified doctor and is the one who provides the fit for duty or clear sheet so workers can get back on the job after a claim. He'll share information about how to handle exposure on the job and how to prevent exposure. Dr. Polanco has been a practicing physician over the course of the last 44 years. His primary expertise is in the field of occupational medicine and pain management, but also has a broad base of medical experience, including critical care and respiratory medicine. As a medical director for HealthQuest Medical Services, Inc., Dr. Polanco evaluates and treats individuals who have experienced a work-related injury or exposure. He is a level 2 provider in the state of Colorado and certified to perform impairment evaluations. He performs medical evaluations and provides and directs diagnostic testing, rehabilitation, and interventional pain management services. Dr. Polanco, I'm going to throw it to you now, and thank you for joining us and talking to us today.
Well, good morning, everyone, and welcome to the Colorado Springs COVID Town Hall. Again, I am Dr. Frank Polanco, your host speaker today, and here to hopefully answer your questions. I welcome all of you for attending this, and today we're going to discuss the COVID virus in the workplace. As just briefly mentioned, again, I've been practicing 44 years. And my primary specialty is occupational medicine. So I'm evaluating and treating individuals for workplace injuries and workplace exposures. I have experience in the past with respiratory care, critical care, and I've been involved in those type of settings. Here in our clinic, we've been open throughout the pandemic and helping employers trying to get individuals back to work and informing them regarding the aspects of this COVID pandemic. So hopefully after a brief review of some of these things, I'll answer some of your questions. As of today, in the United States, we've had 844,000 cases and 46,851 deaths in the United States. So this is a very important issue for employers and for the general public. There's a considerable amount of misinformation out there and confusion, which creates fear, particularly for individuals that are getting back to work. So what I'd like to do is to start today with sharing some facts with you. And I want to remind you that facts are our friends. It'll help dispel some of the misconceptions out there regarding this pandemic. So the COVID virus is a new virus to humans. So we really have not developed any type of immunity against this virus. It is a cousin of the COVID virus family, which is the These are the viruses that cause the common cold, and in the past have created the MERS and the SARS epidemics. These viruses are common to animals and to humans, and the animals that are primarily the carriers are camels, cows, cats, and bats. So the MERS and SARS and the COVID viruses are bat viruses. So the bat viruses have been transmitted to humans, and now we have human-to-human spread. The difference in the COVID virus, it's very different than the SARS and the MERS viruses in that it is extremely more contagious than those viruses. In fact, it's 3 times more contagious than the flu. For each individual that contracts the disease, approximately 2 to 4 more individuals will become infected. So contagious individuals can be asymptomatic up to 48 hours prior to developing symptoms. And it's thought that these individuals are no longer contagious 2 to 3 days after the resolution of their symptoms and their temperature. So in regards to the spread of this virus, it's a respiratory virus. So it's transmitted through aerosol, droplets, hand-eye contact. Here in Colorado, it started with a lady who had the infection, and she was at a bridge tournament and spread it to the other people that were attending that bridge tournament. And a number of people lost their lives as a result of that. They were in the higher risk category, older individuals. And that's why initially Colorado had a high death rate. The lifespan of this virus on surfaces has been studied. They found that on copper surfaces, it lasts up to 4 hours. On cardboard surfaces, it lasts up to 24 hours. And on plastic and stainless steel, it'll last up to 2 to 3 days. So we really don't need to be concerned about delivery packages coming from UPS or Federal Express or packages from China. We have not identified transmission through those methods. It's not transmitted through our water supply or our food supply, although it's important to wash our vegetables and our foods to decontaminate anything that might be on there. An interesting study was conducted in California through USC and Stanford, where they tested a large number of individuals. And what they found was that the coronavirus has been widespread, and up to 4% of the population tested positive for antibodies. So they concluded that in the Santa Barbara, Los Angeles area, up to 81,000 individuals had had the infection, as opposed to the 15,000 that had been reportedly confirmed. The death rates are much higher in older individuals, and approximately 80% of the deaths are in individuals that are 65 and older and who are in a higher risk category. So in regards to identifying individuals that possibly have the disease, the symptoms typically are that they feel ill, they develop a headache, a cough, usually will develop a temperature of greater than 100.4, and they'll have gastrointestinal symptoms. Some people have the loss of smell and taste as well, and the more severe individuals will develop chest pain, disorientation, and have a bluish discoloration to their lips and their face. Now, temperature isn't always a reliable aspect in that only 25% of individuals presenting to the emergency rooms have a temperature. About 50% of the individuals will have gastrointestinal symptoms, abdominal pain or diarrhea. And a good many of them will have a loss of smell and taste, and the loss of smell is primarily a conductive loss, meaning that it's not a nerve issue, it's the cells in the nose become inflamed and that impacts our ability to smell. So usually these symptoms develop 5 to 6 days before, or rather, the individual develops contracts the virus and then develops symptoms about 5 to 6 days afterwards. The severity of the infection varies tremendously from being asymptomatic and having no symptoms. And they found that many younger individuals and children have been asymptomatic. The majority of the people that contract this virus will have a very mild form of the disease. And the more severe form is in the higher risk individuals. And those are individuals that are over 65, that are immune compromised, that have are in treatment for cancer, have COPD, diabetes, or heart disease. The recent studies have found that those individuals that have hypertension, diabetes, and obesity have a much higher rate of complications once they contract this disease. So it's important to identify in the workplace those individuals that are more at risk to try to protect these individuals. So from a employer guidance perspective, what we're recommending from a medical perspective is that, first of all, employers develop a plan. And that plan should involve, as we've all heard on the daily briefings, mitigation, social distancing, personal protective equipment, and education. Education is very important because there's so much misinformation out there. So it's important to educate your employees so that they know what they should be doing on a daily basis to minimize their level of exposure. So as employers are familiar with safety, this is very similar in the sense of prevent, prevent, prevent. So it's similar measures to what employers have done before. So if you have an individual that is sick, the recommendation is that individual stays home. Use mitigation measures for all your employees. Provide them with masks, educate them as to social distancing, provide sanitizers with frequent hand cleansing, and realize that individuals who have facial hair will have more difficulty in wearing the masks. Avoid physical contact and clean tools after use, and particularly clean restrooms after every use as well. Train the individuals on the proper use of the personal protective equipment. Train them on respiratory etiquette. You know, cover your mouth and your nose when you sneeze or you cough. Wiping down the tools, and again, safety training and awareness is very, very critical. I had an employer yesterday, in fact, call me, and they were they had an employee who had family members, about 3 family members who were ill. The individual was wanting to come to work and they didn't know what to do. So the next phase is what do employers do when they have an individual that is ill or that has come into contact with someone with COVID, or maybe even has had the COVID virus themselves? So first of all, again, develop a protocol and a plan. Respect individuals' privacy. What you want to do is to have a plan in place so that when individuals present that either are ill or have had the illness, you know what the steps are. Here in our facility, we've developed a protocol for screening individuals in regards to returning to work. So relying on your medical provider is very important. This is something that you should not take upon yourselves as employers to screen these individuals for coming back. It's much safer to have your medical provider screen them for you so that when they get back to your work, you know that the appropriate steps have been taken. So from a workplace perspective, what you want to be doing is screening every day. The most important aspect are questions. Are you feeling ill? Is anyone in the family ill? Have you come in contact with anyone that has been ill or has been tested positive for COVID? Have you developed a temperature? Now remember, temperature is not always a reliable aspect because only 25% of the people will present with temperatures. Again, if you have someone who is feeling ill, they should be sent home and should self-quarantine for 14 days. We don't have any specific treatment for COVID viruses yet, although some treatments have been put out there in recent information regarding the updates, use of hydroxychloroquine and some of the antiviral medications, but that really doesn't pertain to us today. So again, if you have an individual that's feeling ill, you send them home. If you have an individual that becomes ill in the workplace and they develop a temperature, the important aspect is to do contact tracing. So the important thing is to figure out what contacts this individual has had with, which individuals have had prolonged contact with that person, and those individuals that have had prolonged contact should self-quarantine. That individual should be sent home for self-quarantining and should contact his medical provider for ongoing medical treatment and screening. For those individuals that have had the infection, have been tested positive for COVID and want to return back to work, they should undergo a screening process. We've developed a telemedicine screening process where we track their symptoms. We make sure that they've been afebrile or without a temperature for 72 days without having had use of anti-fever medications. Their symptoms should have resolved or mostly resolved, and those individuals who have previously tested positive need to undergo 2 negative testing screens. Again, 72 hours of being afebrile, symptoms resolving, and 2 negative screens for those individuals. Now, warning signs on the job for employers of individuals that are extremely ill are difficulty breathing, chest pain, confusion, and bluish discoloration of their lips and their face. So again, just briefly reminding you, awareness is critical. Having a plan is extremely important, and educating your employees as to what they should be doing and the signs that should be looking for. Providing them with paid leave is something that's been highly recommended so that those individuals won't be tempted to go to the workplace just because they need to work. And they might be tempted to go to work even if they have mild symptoms. Those individuals, you really want to keep them home. I think from my perspective, what I'm seeing in the workplace, I think it's an important aspect to discuss with your employees that are at higher risk, those that are at an older age category, those that are extremely obese or that have medical illnesses such as heart disease and diabetes. And those are the ones that you particularly want to protect. They might even want to consider staying home until more of the workforce gets integrated back into this aspect. Of course, you can't discriminate, but you can certainly advise. So at this point, I think I'm open for questions.
Sure. Thank you so much, Dr. Frank. We do have some questions here. One question is, I've heard that this is not an airborne virus. Are the masks just a precaution from sneezing?
The mask is used to protect other individuals because When we get the virus, we're asymptomatic for a number of days, but we are infectious for 48 hours prior to developing the symptoms. So in using the mask, we are protecting others, not necessarily protecting ourselves. When we are protecting ourselves, we're using the 95 masks, which are the different masks. We're recommending use of cloth masks to protect others and to keep in when we cough or when we sneeze.
Okay, thank you. Another question was, who is your legal resource for advising employers on what they can and can't ask their employees to do, like wearing a face mask or having their temperature taken, etc.?
Could you repeat that one more time?
Yeah. Who is your legal resource, or who would you recommend to be a legal resource for advising employers on what they can and can't ask their employees to do, like wearing a face mask or having their temperature taken?
I don't particularly have a legal resource, but employers can go to the OSHA website and they have guidelines for what they're recommending for screening their employees. Not only OSHA, but you can go to the CDC and look at those guidelines. And as long as employers are following the appropriate CDC and OSHA guidelines, they're within their rights to be able to screen individuals.
Okay. Another question, what about those with asthma? Are they also considered high risk?
I recently looked at a study regarding individuals with asthma, and I was surprised because they found that individuals with asthma do not have necessarily an increased risk. The more of an increased risk is those individuals that have COPD, emphysema, that are longtime smokers.
Okay. You had mentioned 4 stages in creating a plan. 1 was mitigation, 2, social distancing, 3, education. What was the 4th stage?
So in developing the plan, again, mitigation, social distancing, personal protective equipment, and education. Education is key so that your employees know what they should be reporting to you. I'm feeling ill, I'm feverish, or I have members in my family that have become ill, or I've come into contact with an individual that was positive for COVID, or someone from my family traveled to Italy and came home, those sort of things.
Okay. What would you recommend to people for treating themselves at home?
Treating themselves at home is really just symptomatic treatment. Keep yourself well hydrated. Initially, during the course, you can take antipyretics to lower your temperature, such as Tylenol. But wiping yourself down with a moist rag usually will lower your temperature. Ibuprofen is a little controversial. Initially, it was not recommended, but subsequent studies indicated that you could utilize ibuprofen without having any problems in that. So distance yourself from other individuals in your family. Use a different bathroom if you can. Try and use protective equipment around your family. Wipe everything down. But primarily just what you would do if you had the flu.
Okay. What would be the recommendation for wearing gloves in the workplace? Do you have one?
I think it's a good idea, but it's not necessary. I wear gloves everywhere. I don't open doors without a glove, and if I do open doors, I'll back into the door. I'll push it with my elbow. I think wearing gloves is a good idea, but it's difficult to have gloves for everyone every day, and I change gloves at least 6, 7 times a day. Not sure that employers have that capacity to do that, but uh, it's certainly a good idea.
Okay. What about washing your eyeglasses? Do you recommend that?
I think washing your eyeglasses is a good idea with, and you have to remember what you're wanting to disinfect with. The disinfectants should have at least an 80% or greater alcohol content. That's the easy way to clean surfaces. As far as hands, mixing aloe, I made my own hand sanitizer because I couldn't find any in the stores. So I went and got my daughter. I asked my daughter, I said, what has the most alcohol in it? She's much younger than me. She said Everclear. So Everclear is 100% alcohol. So I mixed that with some aloe and made my own. And I carry it in my car. I have some at my desk, and I have some at home. When I go home, my wife actually makes me decontaminate. So I have to remove my clothing. I go to the shower. I take a shower, clean up, and then I'm able to interact with my family.
What is the recommendation for an employee who has had contact with someone who has COVID, presumed positive or test positive, but the employee themselves is not showing any symptoms?
When you've had contact with someone who's had COVID, it's recommended that you self-quarantine for 14 days. And then prior to returning to the workplace, to be temperature free without use of any medications for 72 hours and have not had symptoms or symptoms have resolved.
Okay. Are there any other questions for Dr. Polanco?
So one more thing I should mention, in returning to work, you can do it in 2 different ways. You can do it without testing and you can do with testing. Without testing, again, no temperature, 72 hours, symptoms have resolved, you're doing fine. With testing, same criteria, but you just send them to get a test. Although tests are available, I'm still finding that they're not easily accessible.
Okay. It looks like there are a couple more questions here I'm getting through. This one was, in this case, no staff members have been confirmed with COVID, but our staff has been working remotely, and I'm curious what steps we should take in returning to the office. Should we go in phases, for example, only limited number of staff members to go into office on certain days, etc., or consider it safe for all staff to return as long as the social distancing, mask cleaning?
The latest information that I have reviewed regarding return to work, depending on the environment, let's say an office environment, they're recommending that you bring in 50% of your staff at the beginning, create social distancing, educate them, and then gradually bring the remainder of the staff in. Have half of them work from home, if at all possible. So again, you're creating that environment of social distancing and protective gear to minimize any spread of individuals who may be asymptomatic coming back into the workplace.
Are there going to be contact and trace tracking apps / QR codes, etc. used?
I think that the concern about that is privacy issues. I think if you read on the internet, Bill Gates is wanting to implement tracking for individuals so that if you test positive, you can be tracked, but the privacy issues are going to keep that from happening.
Okay. And how far apart should the follow-up tests be done to clear someone?
So it depends at which point in time, but usually the testing is done after they've been temperature free for 72 hours, symptoms have resolved, At that point, you can send them for a test. If they've not had COVID before, that one test is fine, and they can return to the workplace. Again, they can return to the workplace without a test as well. For those individuals that have had COVID, they need a follow-up test 24 hours. The difficulty that we're having with the testing is that they have a lot of false negative reports, and that's why you want to have a second negative test.
Okay. It looks like that's all of our questions. So we are recording this and we'll be putting this video online. If anybody has questions once they've watched that video, what's the best way to have them ask that, Dr. Polanco?
I'm not sure I understand your question.
So if anyone watches this recording after, and if they have questions, would it be okay if we posted your email address or had a different way to contact you with questions, or would you prefer that we field those and then send them along?
I think posting my email address will be fine. So I'll get it posted onto the website.
Okay, perfect. Well, we so appreciate your time today with us and giving us all this information. It's very much needed right now.
Well, it's been a pleasure, and make sure you make contact with your medical provider so that they have a plan in place and they're ready for telemedicine. We had to develop these protocols since everything is new, and remember, if you do have an individual that is having symptoms, that is ill, do not send them directly to the clinic. Send them home. And their communication with the clinic should be through a telemedicine contact.